By distributing life-saving naloxone to community partners and law enforcement agencies in priority areas, we're providing resources and support in a compassionate way. By connecting people to treatment rather than incarceration, we're providing hope instead of obstacles. This is harm reduction in action. At Cook County, we believe that every preventable death is one too many. It's our responsibility to work together to find solutions to this public health crisis. In the meantime, our first responders need to be equipped with the tools to save lives of our most vulnerable residents. When seconds count, these resources can literally mean the difference between life and death. Now I'll ask Dr. Joshi, Senior Medical Officer and co-lead of the Cook County Department of Public Health, to share more details around this initiative. Thank you. Dr. Joshi.
Thank you, Madam President. In addressing this crisis, we knew we had to save lives, but we also had to work to transform broken systems that traumatize and re-traumatize our communities. We must address these systems that cause and perpetuate opioid use and substance use disorder in the first place. Suburban Cook County is a complex and geographically large region. We serve 2.5 million residents in 125 suburbs across a 700 square mile area. In many cases, our role is to secure resources, connect the dots, and to convene partners. The CCDPH is coordinating with treatment providers, harm reduction advocates, community-based partners, researchers, and other government agencies to carry out this initiative. Establishing deflection programs and distributing naloxone with priority law enforcement agencies and community partners is a key cornerstone of this program. As of this morning, through our pilot program, 78 officers have been trained in naloxone administration and 169 naloxone kits have been distributed. This is just the beginning of a much larger multi-year initiative. CCDPH is also collecting and analyzing quantitative and qualitative data to better understand opioid overdose and opioid use disorder in suburban Cook County. This analysis will be used to inform our public health efforts. Today, you will hear from Harvey, Maywood, and Markham's police chiefs about how naloxone and technical assistance or deflection makes a difference in their communities. You'll also hear from Task, a national leader in deflection, about why this program has national significance. By working together with these and other partners, we're building a comprehensive approach to addressing this crisis. So thank you to all on this webinar for all your hard work and to many, many others that are contributing to this. Next, Dr. Arun Kumar from the Medical Examiner's Office will share what we know about the opioid overdose epidemic in Cook County.
Thank you, President Preckwinkle and Dr. Joshi, for allowing me to shine a spotlight on this public health crisis. Last year, Cook County tallied 1,277 opioid overdose deaths. It was the deadliest year for opioid overdoses the county had ever seen. Until now, in 2020, we are on track to exceed 2,000 opioid deaths. My office has already confirmed 1,498 overdose deaths in Cook County in 2020. Approximately 70 to 80% of more than 600 pending cases will be ruled as opioid-related deaths as well. This means the true number stands at over 1,900. With more than 3 weeks left in the year, our caseload continues to rise. Our Black and Brown communities make up 63% of the opioid overdose deaths our office sees, although they account for just under half of the county's total population. Men account for more than 77% of these deaths. Some may be surprised to learn that 45 to 54-year-olds in Cook County are most likely to die of an opioid overdose, and even more surprised to learn that 55 to 64-year-olds are the second most likely age group to succumb to the disease in Cook County. The COVID-19 pandemic has overshadowed the opioid crisis this year, But this crisis deserves our attention. It has quietly cut down so many lives and left families devastated in its wake. 2020 will be remembered as an extremely difficult year for so many reasons. For 2,000 families across Cook County, it will be remembered as the year that opioids took their son or daughter, parent, sibling, aunt, uncle, or dear friend. These are losses that could and should be prevented. At the medical examiner's office, my colleagues and I are the last physicians to see these individuals, and at that point, it is too late. I'm proud of our partners at Cook County Public Health to take the lead to stem the tide of these deaths. Thank you.
Next, I'd like to introduce Jack Charlier, who's Executive Director of Task Center for Health and Justice.
Good afternoon. And first of all, thank you to the Cook County Department of Public Health for your leadership on this truly groundbreaking initiative. As President Franco-Winkle said, my name is Jack Charlier, and I'm the Executive Director of Task Center for Health and Justice. I'd like to start with a couple words about what deflection is. Deflection gives a practical, workable option to police and other first responders when they encounter someone who's at high risk of overdose, or who has overdosed, or who's in need of substance use disorder treatment. And then instead of arresting that person or overburdening our emergency rooms, deflection offers another option, a third option. It's a warm handoff to treatment, to case management, or other supportive community resources. Now, why is deflection important? This work is critically important and timely, as you have heard so far during this press conference. As Cook County is facing an ongoing and worsening opioid crisis, deflection can help save lives. What is more important, indeed, than saving lives? And it does this by quickly getting people the help they need before they overdose. Now, what's unique about deflection is that it happens through partnerships of co-responders, law enforcement and other first responders, treatment providers, social service providers, case managers, and community members, all working together to get people the help they need before they end up in the justice system or in our emergency rooms. Deflection, however, is not a one-size-fits-all approach. We will work with each police department and community to help them create a customized program that fits their vision based on their unique situation, needs, and resources. Now, the work of the Cook County Deflection Initiative also has national significance. Thanks to the leadership, as I said, of the Cook County Department of Public Health, 12 police departments and communities will be starting new deflection programs as part of this initiative. This initiative, the Cook County Deflection Initiative, represents the largest single cluster of deflection sites ever conceived, created, and implemented in such a short period of time anywhere in the nation. This initiative is a huge first step toward bringing deflection to scale, moving up the point of time at which people at risk of overdose or in need of substance use disorder treatment can in fact access and get that treatment that they need. Now, how does this work? Well, TASK will provide tailored technical assistance to law enforcement agencies and communities in Cook County. TASK, through our Center for Health and Justice, for the past several years has been helping communities across the country develop their own customized deflection programs. We are the leading national technical assistance provider on deflection in the United States and work closely with a variety of entities, including the federal government, through initiatives such as the Comprehensive Opioid, Stimulant, and Substance Abuse Program, COSAP. However, through this initiative in Cook County, TASK will help law enforcement and other community partners develop, as I said, their own customized deflection co-responder programs meeting the needs and the vision of that local community. Our task deflection specialists, who are the staff that will be out and about working with community and law enforcement and treatment and the people who are deflected, will also be providing training on preventing overdose, on the administration of naloxone, and how to help these people access who are in need of treatment evidence-based resources. Our next steps coming up are right next week on December 16th. This initiative will get started formally then with a virtual orientation for participating Cook County suburban police departments. From there, we will begin developing the specific programs and training needed to get each department and community's deflection program customized exactly as needed for their community and for the people they want to serve. The person who will help lead this up in Cook County is my colleague, Nicole Munoz, who is the administrator for this program at Task Center for Health and Justice. Nicole, over to you.
Thank you, Jack. I'm proud to be a part of this work and echo your thanks to Cook County Department for Public Health for this groundbreaking initiative. I'd like to acknowledge my colleagues, Wendy Stanfill and Michael Black. Together, we represent the task deflection specialists who will be providing the training and technical assistance that Jack just discussed. Thank you again to Cook County and to all the participating police departments and communities. Every day, we see the urgency of this work in our communities, and we're looking forward to working with you to help save lives. I'd like to ask Chief Talley from Maywood to speak next.
Thank you, Nikki. I'm very appreciative of being part of this initiative and personally very appreciative of the leadership from President Preckwinkle. Maywood's 60153 zip code, which includes Broadview, which is 60155, has one of the highest mortality rates of opioid overdose in suburban Cook County. Our officers use naloxone to reverse overdoses weekly and sometimes as often as more than once a week. To date, my agency has used naloxone on over 42 incidents. Law enforcement has to contend with individual organizations, technologies, and to operate to facilitate illegal drugs, including fentanyl, which is one of the driving forces in the rise of opioid overdose deaths. In my readings about deflection, I have learned departments with those participations connect with people who use this drug treatment. These partnerships are based on the principles of non-arrest and seek to facilitate early diversion from the criminal justice system. It is my understanding opioid deaths involving multiple substances among youth found to be more common than overdose deaths involving only opioids. I believe that effective treatment through deflection is a key factor toward getting those individuals off of substance abuse and use. I also believe medical professionals and providers recognize that co-occurring substance use disorders are common, and deflection can assist them with addressing the substance use simultaneously. Chief White from Arkham can speak next.
Well, thank you, Chief Talley. My officers and I have been purchasing naloxone out of our pockets for some time now. Of course, the prices have went up, so we're grateful for the support. I see this as a tool to save lives. We've been able to use naloxone to revive several victims. Deflection is also important to us. Our first priority as a police department is to help people. So we don't want to be locking up people just because of dependency. We've been combating opioid use for the better part of 2 years now. There was at one point the entire length of 159th Street was nicknamed the Heroin Highway. We have that under control now. But at its height, we were seeing 2 to 3 deaths by overdose every month. One death is too many. Chief Collins will speak next.
Chief Collins, I think you're muted.
The two of the priorities of law enforcement is the protection of life and also the protection of property. Protection of life is a priority, and sometimes instead of just arresting people and keeping them in that cycle, you just have to help people. And that's one of our duties as law enforcement. We have to help people. That's one of the hats that we wear. And if we can give them an off ramp to get out of that cycle, to get them the help that they need, then that's what we are supposed to do if that opportunity exists. I want to take an opportunity to thank the Cook County Department of Public Health. I want to take the opportunity to thank TASC because they have been working with us to get our program off the ground. They've assisted us in identifying other resources that we can tap into that will provide counseling services for people. We've identified other areas where addiction also exists, such as in commercial sex workers. Drugs are prevalent in that particular area. So we want to try to get the deflection going to get people out of that life and away from drugs and into services that can increase the quality of life with them. The naloxone is actually a life-saving drug. With that on the street, just moments it takes for someone to lose their life. And in our community, we've already had several lives lost this past summer over overdoses. And naloxone is a life-saving drug that it was so important that the state mandated that police have this on the street with them. And this program helps us to fulfill that unfunded mandate. So thank you for the opportunity to participate in this, and I thank all our partners.
All right, thank you very much. I want to thank all of our participants in the press conference, and I'm going to turn to Nick for questions.
Hello, everybody. We have a couple questions from reporters on the line. The first comes from Rachel Hinton from Sun-Times. It's a dual question. Why do this now, and why focus on deflection? You want to take the first part, Madam President?
Sure. Dr. Runkelmeyer informs me that we're heading into 2 years in a row in which we've had significant overdose cases. This year more than last year, and last year was the highest we'd ever seen. So we're in a very bad place. And she also informs me that we've seen a 50% increase week over week in our opioid deaths, and this year over last year. And again, last year was the highest number that we'd ever seen. So we're at a critical moment. I guess that's the best thing to say. And then I would ask TASC to respond as well. Jack?
Yes. Thank you, Madam President. As to the question of why deflection, so to answer that, think about the totality of all the things that Cook County is doing right now to address the opioid epidemic, to save lives, to help people get connected to treatment. Deflection puts in play the law enforcement community and the EMS community to be part of that. So it fits in with the overall set of activities that are needed in communities to save the most lives. And that's what deflection is about, by connecting people to treatment, housing, services, and case management. Absent deflection, you are not leveraging all those contacts counted in the tens of thousands and hundreds of thousands that exist every year that law enforcement, fire, and EMS are having in Cook County. And you're missing that opportunity to connect those people to treatment.
Nick?
Great, thank you, Jack. We have another one from Rachel. And this one's for Dr. Joshi. So Rachel asked,
Nick, I think you may be muted, but I can see the question here. So in brief, asking for a status update on the distribution of naloxone to communities in suburban Cook County. So our goal is to, yes, indeed, to blanket the community with as much naloxone as possible. We're funded to distribute 2,500 kits by the end of September of 2021 and train 1,900 officers to administer those kits. We're at the very, very beginnings of this, and so to date, we've distributed 169.
all right, thank you, Dr. Joshi. Apologies for the mute. Another question from Kristen. So question is, Charlier mentioned 12 police departments will be part of this initiative. Which police departments will be part of this initially? How are they chosen? Is the goal to have all suburban police departments join this initiative?
Sure. Thank you. Yeah, thank you for that question. I want to make sure I was going to be answering that. So the 3 departments that you see on the press conference today are first 3 out of the box of the 12, and that 12 is just for the first year, right? So that's the initial group of departments. They will be selected based on data that the county has provided us, and we will be working with to select those departments and communities, more importantly, that are experiencing the highest rates of opiate overdose and overdose death, right? That's the focus and target of this Cook County Deflection Initiative. So that will be the selection process for year 1 for the first 12 departments.
All right, thanks, Jack. All right, now we have a couple questions from Alice from the Tribune. First question is, how might the pandemic have contributed to this year's rise in deaths? Could factors ranging from unemployment or fear of going to an ER have contributed to these deaths?
Well, this is an extraordinary time, and surely levels of stress and anxiety are very high. And sometimes folks are tempted to deal with that stress and anxiety with self-medication. So I guess I'd say that this is an extraordinary time in terms of the stresses on individuals and families. I think that, frankly, that's a more important issue than reluctance to go to emergency rooms, but I'm sure there's some of that as well, given the fact that so many folks have entered our emergency rooms and hospitals with COVID.
And then Alice has a follow-up question. So what about non-pandemic related factors? Because she believes that the numbers were rising before the pandemic started. Is that true?
Yes, Dr. Runkemar, do you want to answer that question? I'll put.
So the numbers were starting to increase from earlier this year. Before the pandemic started, there was a spike when the stay-at-home order was instituted. After that, the increase is still continuing. As to factors why we are seeing an increase in 2020, I mean, it is just more people are using it. The population that is using is dying from drug overdose is more non-Latino Blacks and the Hispanic community. That is what the data shows from our office. Why? Again, we can provide the data, but it's hard to explain a reason as to why we're seeing that. Maybe public health can relate to that answer as to why. We can easily see that in the data we have, though.
Okay, so we have another follow-up question, probably for Dr. A as well, and our law enforcement officials. So what is the medical examiners or law enforcement data telling you about what types of opioids are being used the most and where the source of those are?
The types of opioid that is being used the most is fentanyl. We're seeing more fentanyl compared to any of the other different fentanyl analogs or even heroin. So the increase is mostly due to use of fentanyl with other drugs, but the most common incident is fentanyl. With respect to where people are getting the fentanyl from, again, that would be a question for law enforcement of the DEA as to the source of the drug.
So do any of the law enforcement professionals on the line want to take that second question? Where are you seeing these drugs coming from, if you know?
Well, for the city of Harvey, obviously, as in other communities who struggle with drug dealing, the actual source varies. But these are street dealers. From what we're experiencing here, the street dealers. For the ones who are addicted, we are seeing the heroin and the fentanyl, as the doctor stated. But for the most part, it's just from the street dealers and where people are getting their where they're getting their drugs from.
Right, thank you for that. Rachel has a follow-up question for Dr. Joshi. Where does the funding for the kits come from?
Thanks. We're funded, I think, through a 4-year grant from the Federal Substance Abuse and Mental Health Services Administration.
All right, thank you. Okay, so we have an off-topic question. So pending federal approval, how many people in suburban Cook do you intend to see vaccinated during the very first round of vaccine distribution? And when would that start? How about when all suburban Cook County adults will be vaccinated? Dr. Joshi, do you want to take that one?
Sure. Yeah. So clearly, this is the question of the hour. So as viewers may be aware, the Centers for Disease Control and Prevention have released some preliminary recommendations as to who should be vaccinated first. And that includes high-risk healthcare workers. So that means folks that work in hospitals, along with residents of long-term care facilities and staff at long-term care facilities. So that would be really the first wave of individuals to get vaccinated, and then we would expand outwards from there. As I'm sure you're aware, the governor and the director of the Illinois Department of Public Health have both commented that it's going to take many, many months before all suburban Cook County residents are vaccinated.
All right, thank you so much. Thank you for the questions that were asked. That is all for today. Appreciate you all.
Thank you. Thank you, Dr. Lamar. Thank you, Natalia. Thank you, Nick.